This podcast is about the middle range theory of uncertainty in illness by Mishel. Now, I want you to look at the model and kind of familiarize yourselves with the progression, because I'm going to be speaking about each of those little boxes in depth as I move through this podcast. According to Mishel, this theory explains how individuals construct meanings for an illness event. In the model, there are 4 major phases, and I will explain each of the phases in detail. Before we begin, uncertainty as defined by Mishel is, quote, the inability to structure meaning, end quote. It occurs when an individual cannot develop a cognitive schema through which the illness event is interpreted. A cognitive schema consists of a stimuli frame, cognitive capacity, and structure providers. These 3 precede uncertainty and are involved in information processing. Uncertainty exists in 4 forms. 1 is ambiguity related to the state of the illness. 2 is complexity of the treatment plan. 3 is lack of information about the diagnosis and seriousness of the illness. And 4, unpredictability of the course and prognosis of the disease. Uncertainty itself is not a negative thing. It is neutral until the person appraises it. Uncertainty can then be considered a danger, or it can be considered as an opportunity. More on this later. The stimuli frame, as I've said before, consists of the symptom pattern, event familiarity, and event congruency. We will discuss each of these individually, but as a whole, the stimuli frame helps the person understand the illness, which creates less uncertainty. Symptom pattern. Symptom pattern is the degree to which symptoms present with sufficient consistency to form a pattern or configuration. Inconsistent symptoms cannot be used to gauge the extent of an illness. For example, if a person has diarrhea with milk products, but not each and every time, he or she becomes uncertain as to just what that means. The person may question, do I really have an illness or not? Chronic illnesses with relapsing and remitting characteristics seem to cause the most uncertainty in patients. Emotional arousal can interfere with symptom recognition because anxiety and/or depression can lead to thinking that the illness is more severe than it actually is. Again, to provide an example. A person with a new diagnosis of diabetes may suffer from anxiety and call the primary provider with a blood glucose of 125 after a meal because it is higher than he or she expected. This causes uncertainty even though the reading is actually in a very good range. Symptoms must be salient or prominent enough to be included in the appraisal. If a person who has terminal cancer and is not suffering from pain may have uncertainty as to the stage of the illness because he or she believes that dying from cancer always involves pain. To assess the nature of a symptom, a person must be able to distinguish one symptom from another. In the case of the person with a newly diagnosed diabetes, it may be hard to distinguish between the symptoms of an anxiety attack and those of low blood sugar since they are very similar. According to Mishel, if symptoms are consistent, predictable, salient, and distinguishable, then a symptom pattern can be identified and the uncertainty will be less. 5. Event familiarity. Whereas symptom pattern refers to the structure of physical symptoms, event familiarity refers to the patterns within the healthcare environment. It is developed over time and in a setting. If the person has a new event and it fits into his or her understanding or cognitive map, then the event is evaluated as familiar. For example, if a person with breast cancer is receiving chemotherapy in an outpatient facility and she is required to go to another facility, her cognitive map learned at the first center will be used to evaluate what is happening at the new center. For example, she sits in a chair and an IV is placed in her hand. Although the chair and the IV equipment are different, they fit into her understanding of the process of chemotherapy and thus is familiar. Novelty and complexity of events increases uncertainty. For example, if our woman with breast cancer all of a sudden must be hospitalized for her chemotherapy because of decreased immunity, she may suffer uncertainty because of a first-time hospitalization, which is associated with few familiar clues. She may also need to be placed in protective isolation, which makes the process more complicated and further increases her feeling of uncertainty. According to Mishel, novelty appears to be the aspect of unfamiliarity that leads to the most uncertainty, and as the novelty decreases, so does the uncertainty. Event congruence. Event congruence is the consistency between what is expected and what is experienced in illness-related events. If a patient expected a cure from undergoing radiation therapy and had 5 years of cancer-free checkups, then suddenly the tumor recurs, his or her uncertainty will be increased. Uncertainty can also be caused by the lack of a cure or diminishment in symptoms within a certain time frame while undergoing treatment. The opposite is also true. If a patient undergoes treatment and the disease state is cured or abated in a shorter period of time than he or she expected, there's also going to be uncertainty. Cognitive capacity refers to the information processing abilities of persons. Any physical problem will diminish the cognitive ability of the person since it reduces the ability to concentrate on a task, processing information about a disease. For example, being extremely short of breath will limit understanding about COPD. Other situations that influence cognitive capacity include pain, drugs, and nutritional state. Dangerous situations also diminish cognitive capacity since the person is more narrowly focused on the problem at hand and only entertaining that which is of utmost importance. For example, in a car crash, instead of being concerned about the open fracture of her leg and profuse bleeding, the young girl is most focused on what is happening to her new dress. High levels of stress also affect the memory aspect of cognition. Recall can be absent. Impairment of memory and thinking, whether the result of demands that monopolize cognitive resources or because of factors that alter cognitive abilities, weaken the accuracy of appraisal, causing environment events as being uncertain. Structure providers are education, social support, and credible authority. Structure providers are the resources that a person has to assist in understanding the stimuli frame. They directly reduce uncertainty when the person relies on the structure providers to help interpret the illness event. They provide indirect reduction in uncertainty when the providers help with pattern recognition, event familiarity, and congruence of the events. Education. Education has been shown to directly impact uncertainty since the higher the education, the increased ability to modify uncertainty in a faster manner. Individuals with less education seem to require more time to make sense of an illness event and experience uncertainty for longer periods of time. Education indirectly assists in supplying structure for meaning-making because the person has a larger knowledge base with which to associate events. Social support acts to prevent uncertainty in various life crises by supplying feedback on the meaning of events. Social support directly modifies three types of uncertainty: ambiguity related to the state of the illness, complexity of treatment, and unpredictability of the future. The uncertainty of illness is abated when information about ambiguity, treatment, and the trajectory is shared among support members. The social group also helps individuals to handle what is to be considered threatening situation by lending expertise. Social support, such as assistance with household tasks, also decreases the uncertainty of the illness experience. Each of these means of support not only applies to the patient, but also the caregiver. Credible authority refers to the degree of trust and confidence patients have in the healthcare provider. Credible healthcare providers decrease uncertainty mainly through the processes of the stimuli frame. They provide information about the causes and consequences of the illness experience. They also help decrease uncertainty when the care is consistently provided by the same healthcare providers in the same system. It provides illness familiarity. They also can provide event congruence when they help the patient with interpreting the experience. Trust and confidence in the healthcare provider leads to less uncertainty, less ambiguity about the illness, and less complexity regarding treatment. Now we want to look at two terms which are uncertainty and appraisal, and I want to give you the definition of each. Inference are general beliefs about oneself and the world. Illusion are beliefs created that have only positive aspects. Inference. Relationships with the world include the dispositions of the person, including learned resourcefulness, a sense of mastery, and locus of control. Having these attributes helps the person believe that they can deal with all the vicissitudes of life. In other words, they have the ability to handle almost anything. Learned resourcefulness and a sense of mastery usually reflect upon past events, therefore do not have direct application with uncertainty in illness because the illness is in the present. Locus of control is more active in uncertainty of illness. For locus of control to be used, there must be ambiguity in the situation, i.e., uncertainty. If one has an internal locus of control, the uncertainty of illness may be viewed as an opportunity, since one would view it as under one's control. If one believes in external control, then the uncertainty of illness may be assessed as being dangerous, out of one's ability to control. General knowledge provided by healthcare providers and or significant others about similar situations can also help alleviate uncertainty, especially if the other situation is similar to the one that the person is experiencing. Illusion. This is akin to denial and avoidance, but does not have the negative connotation. For example, when a diagnosis is ambiguous, the person who must live with the uncertainty can sometimes receive comfort in the thought that maybe, just maybe, there will be a positive outcome. It is a sense of hope in the light of destruction. When uncertainty is considered to be a danger, the inference appraisal was one that harm is coming. It is associated with a pessimistic outlook, a negative evaluation of the future, elevated anxiety, depression, and distress. Antecedents to the appraisal include loss or absence of a credible authority or diagnosis and during treatment. There has also been research done that shows that increased levels of corticosteroids and catecholamine release happen during danger. Coping happens through mobilizing direct action, vigilance, or information seeking. Direct action and vigilance are used less often than information seeking. Information is sought from healthcare providers who structure information so that uncertainty is prevented in the first place or help alleviate it once it has occurred. Significant others also reduce uncertainty by clarifying information or interpreting events that may have happened while the patient was highly anxious and the situation was disorganized. If the mobilizing actions are not effective, then the affective management coping strategies are called into action. They involve calling upon one's faith, disengaging from the whole problem, giving oneself a pep talk, playing with ideas, or wishful thinking. Uncertainty as opportunity occurs when the appraisal leads to the assessment of a positive outcome. The situation has to be so amorphous that the person can reform it or reframe it into a positive. Usually this occurs with situations that have a highly negative outcome with a known downward trajectory, for example, death. Patients, as I said before, may prefer to maintain uncertainty because it gives hope. Coping is done to make sure that the uncertainty continues, for if the information is taken in that supports a negative outcome, the uncertainty is shattered and the positive outcome is destroyed. Buffering is done through blocking new input, selective ignoring, and avoidance, for example, ignoring differences between oneself and those doing better, or identifying characteristics that are different from oneself in patients who are failing. Adaptation is defined as the biopsychosocial behavior occurring within the person's individually defined range of usual behaviors. It is essentially a neutral state. It allows goal-directed behavior. It can be seen as adjustment or recovery and is usually the end of uncertainty. And I hope this little podcast has increased your knowledge of Mishel's uncertainty in illness.